Grab a cup of coffee, sit back, relax, and enjoy the show.
Hey everybody, I'm Dr. Nick Circolone. I am so excited to be here as always. Well, today we have a special show for you. We're going to be talking about insurance and how insurance works in the healthcare field, because a lot of people have a misconception about how it actually works. But don't forget to subscribe, comment, and like the show. And with me today is going to be my office coordinator, Shay Schultz. We're going to be talking about how to use your insurance, how your insurance may work and may not work. And there may be things you're going to learn that you did not know before about your healthcare. Now, remember, real quick, before we even get started, I want to let you know, healthcare is a thing that you have with your insurance company. It's not something that you have with the doctor. I'll talk about that more. Stay tuned. And without further ado, let's bring Shay on. Hey, Shay, how's it going?
Good. How are you?
I know that you don't like doing this, and thank you for doing it with me and hanging out with me and enjoying it. So listen, we're gonna make you a YouTube star yet. Listen, I'm not a YouTube star, so maybe one of us will become one. You know, a lot of our patients come in and they have insurance, and they give us a card and they go, "What's this do?" Or even before they come in, what's one of the biggest questions they ask is, "Do you take my insurance?
Are you in network with my insurance?"
Yeah. Now, is that the question they ask more rather than do we take your insurance or am I in network?
It's more of a, are you in network?
Well, that's interesting, because a lot of patients before used to go, "Do you take my insurance?" Which is interesting, because now patients feel like, I have an insurance card. Now I want to use my insurance. And are you a provider for my insurance? But what they don't understand is that there's limitations to their insurance. There's problems with getting the doctors paid. And sometimes the payment for that insurance is well below the average of what the doctor charges. And that becomes a problem, I think.
Yes, it does.
So how do we do that? You know, is the provider covered on my insurance? We talked about that. Are they covered? Are they in network? A lot of times we are in network, aren't we?
A majority of the time, yes. There are a select few that we are not.
Right. And then now what we're finding is that the ones that we are providers for are not reimbursing the way they should be reimbursing.
Correct.
So, people go, well, you doctors are just making so much money. It's like, maybe they should be cutting your fees. Well, a good example of that is one of the insurance companies that we have pays us only $20 for a visit.
You have two insurance companies that do that.
Okay. So that to me is not fair. If you're going to pay me $20 to do all the work that we do in the office, that's not fair at all. We need to make money in order to pay employees, in order to pay the light bill, in order to pay the mortgage. And if we get a bunch of patients at $20, that doesn't cover anything. When we tell patients that, or we're getting ready to tell patients that, because, we're going through an audit at the office, we're trying to figure out what insurance companies are paying us, what insurance companies aren't paying us a fair rate. So what are we going to do in a case like that when somebody's, has an insurance that doesn't cover anything? What have we been talking about doing?
Moving to cash practice, to a cash practice.
Because number one, it helps us do the job that we want to do. Plus, it also allows us to make a decent living on what we're billing. One of the things that gets me as far as billing is, and patients don't understand, is not only do we take a reimbursement that is well below an average cost, and that's just with chiropractic. So let me rephrase that. And as a chiropractic orthopedist, if you want to get adjusted by someone and go in there and they say, "Oh, so what's bothering you?" "Oh, my neck's bothering me." Crack, 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 send you out the door. "All right, pay me $20. That is not what we do in our office. Every patient that comes in there, we're doing exams, we're checking things out, they're spending time with me, we're talking. As a chiropractic orthopedist, I'm a one-off. So we're trying to negotiate with the insurance companies now to recontract us, but at this point, we're only getting billed the same amount of money somebody would be getting billed for getting adjustments and out the door. The average patient's in our office about 20 minutes. Wouldn't you say that?
If not longer.
And we go through everything, we find out what's going on. And our job is to get them better and get them out. But when we're getting a substandard reimbursement, that affects the care that the patient's going to get. And we don't change it because of what your insurance pays us. We're changing it because we want to offer you more than you're getting. And actually, it's not going to be getting you more, is it, Shay?
No, and
same thing whether they paid us, whether we take that $20 or not. We just can't afford to keep doing that. And a lot of patients that come in, they're having issues with, hey, I can't afford all of this. So we'll make something where the patient can actually afford our process. And we're talking about this and we're trying to figure out what's going on. But, what's the difference now with me versus our nurse practitioner? Because we have our nurse practitioners with us that bills differently. The medical profession gets billed a little bit different, actually a lot different than what I get billed. And that's why we're in those negotiations right now. So when it comes to our nurse practitioner, if you go to get services with her, they pay okay. Any profession right now in the medical field is not getting paid what they need to be getting paid for the services that they're providing. But we're okay with taking the payment for her services because of the way our practice is designed. You can't go see her and then see me and me bill under her. People have asked that question. I mean, It's like, no, we can't do that. We're two separate providers doing two separate things and have to bill separately. So when a patient sees me and we find out that hey, we really need to see Tasha as well, they're going to have to pay 2 copays, aren't they?
Right.
Because it's illegal to go, oh, I'm just going to charge you 1 copay. And a lot of patients are used to this NOPI. And I think you had started with me. You've been with me almost 9 years now. Mm-hmm. And NOPI has been one of these big things that they were talking about way back when. And what NOPI is no out-of-pocket expense. And a lot of patients feel that they shouldn't have an out-of-pocket expense because they have insurance.
Well, unfortunately, insurance is completely different now than it was then.
Oh, exactly. But patients are still thinking, well, why do I have to pay this copay? We still get that. Not all the time, mm-hmm. but patients still say, well, mm-hmm. why do I have to have a copay? I have insurance. Well, that's the agreement that you have with your insurance company, not with me. Before I noticed that your camera had gone off, but before we were talking about what people don't understand is that reimbursement that we get, there's fees taken off of that reimbursement that nobody knows anything about.
Right.
The fees is credit cards.
Mm-hmm.
We pay a percentage on every credit card transaction that we get. And you and I had discussed this. I think we should be charging the patients for the percentage. And you're like, no, and I'm agreeing. We should not be charging the patients for using that because we're the ones that want to use the credit card machine in order to expedite and make it easier for our patients. But there are some doctors charging the patients a percentage to use their credit card. I don't think that's fair at all. Mm-hmm. And the other thing that we don't charge is we bill your insurance. There's a cost to billing your insurance, another percentage. So every time we bill something through our biller, and every time we use our credit card, we're losing another percentage of that. And I don't think patients understand that.
Looping back to some of those insurances, I have to be on the phone for pre-authorizations for some of those insurances for 30 minutes at a time to make sure that they're able to see you to get the treatment that they need.
So how much is that costing us? That's man time that we're using now.
Mm-hmm.
So if we're spending time verifying insurance, we're paying a percentage of the insurance, and we're paying a billing company for a percentage to do that insurance.
Mm-hmm.
It is better for us personally to go cash base, charge a reasonable amount of money, and then give the patients what they need. And we don't have to deal with those middlemen, which will allow us to decrease the charges that we have.
Right. And on top of that, say that patient comes to see you, you have to see them to do that exam before that authorization can be filed. If that insurance company denies it, we can't charge the patient for it. So that's time lost right there.
Yeah, I don't think patients understand how much goes into a doctor billing their insurance. It's not an easy process. We're just talking from our office. Our office is not the only office that does this. Every single doctor that you go to, they all have to do the same exact thing that we're doing, and they have to make sure that they're getting reimbursed for the services that they're also doing. What's
Right.
interesting is they just came out with the law. I think it was last year, wasn't it? The No
Yeah.
Surprise Act,
hmm
because a lot of places were charging the patients X amount of dollars over what their insurance paid because they didn't let the patient know that their insurance company was not, or their insurance wasn't being taken by that doctor or that hospital. Usually it happened in the hospital where somebody would go into the hospital, they would see several doctors, and several of the doctors would not be in network, and they would get
Right.
these huge bills.
I've had patients come to our office and tell us that that's happened to them.
Oh yeah, yeah, and it's crazy. Now with chiropractic, there's another side of that, and we could we could talk about both because we do medical and we do chiropractic. But what's happening is patients are going into chiropractic offices, and they're going in for this $29.95 introductory offer with exam, X-rays, and first adjustments. But by the time they walk out of there, they have a contract that says, we're going to see you for X amount of visits for this amount of time, and it's going to cost you anywhere from $2,500 we've seen to $7,000 for treatment. And when the patient asks, well, I thought you said you take my insurance. Well, we take your insurance, but we don't bill your insurance. We don't file your insurance. We take
Or there's things in their office that their insurance will not cover.
Oh no, we have that with ours as well because Blue Cross and Blue Shield. That we have I'm using them as an example. We have a global fee that covers everything that we do in the office. Some of the other insurance companies, they're called bundle charges, bundle those charges as well. And we either agree to that charge or we don't agree to that charge. But other insurances like Medicare, we can only do one procedure on a patient, and everything else is carte blanche. But what's interesting about that, and people don't realize this, that if I turn around and I said to a Medicare patient, we're going to do neuromuscular reeducation, where it's trigger point therapy and stretching or PNF stretching, we're going to have to charge the patient for that, because if we don't, what happens, Shay?
We'll get in trouble.
Exactly. It's fraud.
Right.
Not billing the insurance company is fraud. And that's this big thing that we've been dealing with the insurance companies, and everybody's going, well, everybody needs insurance. Everybody has to have insurance. Everybody's required to have insurance. No, we're not required to have insurance. That's something that the people that want to have this global or the one payer system, it would be ridiculous. Could you imagine how crazy that would be if we had a one payer system?
Oh yeah, it'd be terrible.
Everybody who said that they would have insurance, the doctors would have to take every single patient. The reimbursements would be so low that it would be almost impossible to stay in business. But what's even crazier about that, if you've ever been to the DMV, when was the last time you were at the DMV, Shay?
A long time ago.
Yeah. Did you like the experience?
No, I hate the DMV.
Exactly. Everybody hates the DMV. Well, that's how healthcare will be, just like the DMV, unless you want to pay for your services. And I think that that's where a lot of people are going, is pay, fee for service. And I think, concierge medicine has been, on the uprise because people want to go to their doctor, talk to their doctor, not worry if the doctor can do this or if the doctor cannot do this. And they pay a fee and that's it. And that's where we've been talking about going, is more of a fee for service. So that way we don't have to worry about fighting with the insurance companies, because if we write something that's wrong, and this is the other thing we didn't talk about. I mean, we had discussed some questions we asked, but I want people to have this information. If you come into the office, you said it earlier, if their insurance doesn't say we can do the procedures, they're not going to pay for it. And we're out that money for that exam that we did. So we bill the patient for it, right?
Right. But you can't do that.
You can't bill the patient for it. Exactly.
Mm-hmm. If your insurance denies it, you cannot charge your patient that, because virtually all they're going to do is they're going to write that entire charge off so that there's a zero balance.
So what happens when we do, let's say we did 5 visits of care to a patient. The insurance company says, you know what, we want to see the records. And they look at the records and they go, I don't know if we think this is medically necessary. Okay, the patient comes in, the patient was hurting, the patient got better, we released the patient. Now the insurance company says, well, I don't know if that was medically necessary.
Then if they've already paid on the claim, then we have to pay that money back. If the patient's already paid, we have to pay that money back and you're out those 5 visits completely.
People don't understand that. They think that because I have insurance, I'm allowed to go to any doctor, have any procedure I want, and I won't have to pay out of pocket at all, which is not true.
No. And it depends on your insurance. Some people have really great insurance where they can go to the doctor and they have a $20 copay. Or you have that person who doesn't have such great insurance. Me personally, I don't have such great insurance. If I go to the doctor, I'm paying that whole thing out of pocket.
I mean, even with us, our insurance, I mean, I went to the dentist yesterday, just to give you an example, and they're out of network. This is what we're going to talk about too.
Mm-hmm.
They were out of network from us. So my procedure that they were going to do, I have an out of network benefit. I do.
Mm-hmm.
But my out of network benefit has a higher deductible.
Mm-hmm.
It has a higher copay, and certain things aren't covered by that. I knew that going in, but my wife went to the doctor, and the way the insurance was written up, she thought that they were going to pay out of network the same amount that they paid before.
And that's where a lot of patients come in confused.
Yes. And I knew that after we had seen it,
Mm-hmm.
but we like the doctor. So
Right.
we are going to pay the doctor because we like to go to this particular dentist.
Right.
So if patients come in and they like our services and they feel that they're getting value for their services, that's why we're going more to a cash basis to cover some of those expenses that, number one, they're not covered. And number two, even if we're in network or out of network, it's the same price.
Right.
Patients.
Mm-hmm.
I don't know if they can bill their insurance following that. That's fine. We'll give you a way to go bill that.
Well, and it helps too, because some of these insurance companies you've got on the low end, they'll give you 6 visits a year. On the high visit, they'll give you 60 visits a year. Well, on that low end, if you've only got 6 visits that are going to be covered, then that's all you get. You're out of luck. And even then, so I've had patients ask me, I have 6 visits a year. Do those 6 visits, so my out of pocket or my deductible hasn't been met. So just say it's $60 a visit. So they're going to pay $60 a visit for 6 times. Well, then they get upset. All of their stuff has been met. They come back in. They want to be seen again. Well, they don't have any visits left. Well, that's not fair because I had to pay all of that money out of network and now I have no visits left. But my deductible and out of pocket's met now, so I wouldn't have to pay anything.
Again, what did I say earlier? The contract is not with us,
Right.
the patient. The contract is with the patient and the insurance companies.
Right.
And so I think...
But unfortunately, the office is who they get upset with, not the insurance company.
And it causes a rift between doctor and patient.
Mm-hmm.
Now, I have to say this. We have a 5-star review.
Mm-hmm.
We have a 5-star review, not because of the stuff that I do. It's a lot of because of the stuff that you do. Because it's really important to know that you're the one that takes care of making sure the patients are not upset, making sure the patients know what's going on up front.
Mm-hmm.
All of this is really important, but we're trying to get away from you spending time putting out fires because you
Right.
have a lot of fires, Shay.
Well, but I try to be as upfront as possible with everyone on their first visit. And I may not be able to verify somebody's insurance on that first visit, depending on how busy we are. But definitely by the second visit, somebody has an answer. I tell them what their deductible is, how much is met towards it, what their out of pocket is, how much is met towards it, how many visits they have, and what their copay or what they have to pay towards their deductible is.
You know, I have to say this. There are some patients that get extremely rude with you because you're the front person. That's your job and you're awesome. And I'm not saying that because you and I are talking. I will tell anybody. I mean, you're invaluable. I mean, I can't even say how much you do for the company and how much it's important to us to be able to see the patients that come in, because by the time they get to me, they're pretty happy.
Mm-hmm.
But you probably get the ones that are just yelling and screaming and I want this and I want that. So Tasha and I are so blessed to have you, running that front desk. The thing about it is though, when we try our best to make sure we give the patients what they need, the only reason why we're thinking about moving away from some of these insurance companies is because, number one, I think the patients just have a bad contract with the insurance company. And number two, we'll be able to offer them something that they need to offer. And we don't have to see this large volume of patients in order to cover the lights and the the other fees that we have, the mortgages, the payroll and all of that. People don't realize that.
And it would offer you more time to offer different.
Oh yeah, if we offer different services, and we are, that's a great kind of walk into what we're doing. We also do functional medicine. So what functional medicine is not taking over the medical field, because we have our nurse practitioner who does our medical stuff, but functional medicine is for more chronic cases, more things that that are reversible, like heart disease, diabetes. All of these things have the option of being reversed depending on how far they are, of course.
Mm-hmm.
But if we start taking care of ourselves, eating better, making sure our nutrition is not just nutrition, but nutraceuticals are added into there, vitamins, minerals, and taking the right ones, not just taking things at random. We're just taking them with a set priority. Like, we'll do blood work to make sure that the patients get the best nutrition that they can from the best products. The other thing that's really good about functional medicine is that not only are we doing functional medicine to help with chronic conditions, but we're changing people's lives and their lifestyle, and they just become better at doing life because they feel better. But if we need medication, we're not opposed to that. We're actually sending them over to our medical portion of our practice, and they'll be getting it there. Most of the time, they are covered by the insurance companies because we have a contract with them. But then again, we have those that are out of network. For whatever reason, we can't get her credentials with them because they look at the company. We're very unique. Most medical offices will have chiropractic. We have a chiropractic office, chiropractic orthopedics, which is me, and we have medical. For some reason, the insurance companies don't understand that. They can't see that. They have a big problem with that, but that's neither here nor there. We are still offering medical care through our nurse practitioner, which is invaluable. If you come in and you have high blood pressure, well, we could talk about nutrition. We can talk about ways that you can get your blood pressure to come down. But if we don't get that blood pressure down now, there's a chance that we may have serious conditions later on, heart attack, strokes. So we want you to get that under control. And then we'll talk about a natural way of changing your lifestyle so that you don't have to be dependent on this medication. We're not taking you off of medication. We're not putting you on medication. We're making sure you're at a place that's going to monitor that, get you to the point where you're stabilized, and then talk about that life change. And I think that's unique in our office. I think, we're looking at patient care rather than the bottom dollar. And you and I are having this discussion only because we want patients to understand, whether they're in our office or whether they're going to other offices, to be looking for this stuff. We want patients, whether they're ours or someone else's, to get the best possible care they can, and understand your insurance may not be what you think it is. And you need to really delve into it. Everybody has a book, and in that book, it tells you exactly what they're going to pay for and what they're not going to pay for.
Yes, but unfortunately, it doesn't go down. It doesn't do it procedure by procedure by procedure. Oh, no. Unfortunately, I went and had a procedure done and didn't know that it wasn't going to go towards the copay. I have a copay plan. I ended up being responsible for $800 for that procedure and was not aware until I got the bill.
Now, was this before they said the No Surprise Act?
No, it was not.
Now, if you would have went for that same procedure, you would have known up front that this is how much it's going to cost.
Unfortunately, some doctors' offices still aren't following that procedure because mine was after that No Surprises Act. Oh, it was and after. It was after. And I still did not know that I was going to be responsible for that much money.
It's amazing to me how much we don't know and how much we assume, and we turn around and go, well, that wasn't what I didn't think that was like that. But yet it's in black and white. It's really small, but it's in black and white.
Yeah.
That we have to read, and we have to know that. All we're saying is, as we're closing things down, that we want people to understand your insurance is between you and the insurance company.
Mm-hmm.
The fees that we get paid are between us and the insurance company. So we have a choice to either accept that contract or not accept that contract. Unfortunately, patients don't have that option. Of taking their insurance or not taking their insurance. You get what you get if you pay for that, but you have to really know what it is. So I urge everybody, learn about what your insurance covers, learn what your deductibles are, not only your deductibles for in-network, but also out of network. If you have an HSA account, how does your HSA account work? Your health savings account, how does that work? Because for a lot of our services, even though we don't take your insurance, you can still use your health savings account because it is medical type procedures. It is procedures that are covered by your company or by the insurance company, but they're not going to pay for it. So that way you can use your HSA account, because we're getting ready to use our HSA account for the dentist. My wife was looking at getting a new appliance, and it's going to be paid for by the HSA account. Insurance company may pay a little bit of it, but they can use the HSA account, and vice versa. Same thing with us. Your blood work that we do may not be paid by your insurance company, because there's certain things that insurance companies will and will not pay. One of them is vitamin D. Some insurances charge about $30 to have a vitamin D, and other insurance companies don't pay it, and you have to pay $200. So if you have a $1,500 deductible, you get blood work, and then they turn around and say, okay, we're going to pay for this vitamin D, but we're only going to pay this much. You have to come up with that extra, and which you had to do with your insurance. So a lot of people, we want you to understand that. Look at your insurance, talk to the doctors about insurance. Hopefully those offices have a Shay that'll sit down, they'll talk to you, they'll explain what they're doing, how much things are going to cost, and what else is covered and what's not covered, and give you a breakdown.
And all of our patients know I will go above and beyond to help in any way I can, to explain, why you have to pay this certain amount, why this wasn't covered, anything like that. I'm more than happy to help with anyone. Unfortunately, the question I get most of the time is, well, they didn't pay for this. Why? Unfortunately, I can't answer that question. That's when you have to get involved with your insurance company.
Yes, because we can't do that. It's interesting, and I'm, like, as we're really winding this down, most doctors have no clue what goes on at that front desk. They have no idea what's going on. They look at their schedule, they treat the patients, they walk out the door. Everybody else takes care of all that.
And you can tell that they have no clue what's going on in the front office.
Yeah. I pride myself on knowing what goes on because you and I communicate. It's important. Our main concern in our office, and always has been, is that we are patient oriented. The patients come first. I'm old school. They used to say, the customer's always right. Well, the patient is always right. Not really, but we work with the patients to get things cleared up. Sometimes it's not to their satisfaction. It has nothing to do with us. Nothing to do with us. But we try our best to do that. And there's nothing in the office that I don't know how to do or don't know about. Now, I don't do it as good as Shay does. There's no way, but I can still do it. I'm not lost when we sit down and we talk about this, because everything that we do in the office is a group effort. We talk about it, we discuss it, we make sure that the patients are the priority, and we work our way down from that. Would you say that?
Oh yeah, 100%. And I think our patients know that we care about them. I mean, 100%. I love our patients, all of them.
So do I. Real quick, somebody asked me, how do we get patients to do some of the things that we ask them to do? It's because we treat them like human beings. We don't treat them like patients. We treat them more like their family, and we worry about them. We care about them. We know about their kids. We know about their grandkids. And that just, I can't change that.
Right.
I've been practicing now. It'll be 32 years this year, Shay. Oh my gosh,
Yep.
32 years. I cannot change the way I practice. We're
Right.
just going to make it better. We're just going to make it better. Well, Shay, thanks so much for helping me out with this.
Yeah, no problem.
You watching, hopefully you got something from this. Don't forget to subscribe, like, comment, let us know how things are. We love you, and we'll see you soon.